Welcome to our initial press conference from the Joint Information Center established by Dothan-Houston County leaders and Dothan-Houston County EMA. The purpose of a Joint Information Center is basically to be a clearinghouse of information. My name is Chris Etheridge. I'm the Deputy Fire Chief with Dothan Fire Department, and I have been blessed with the opportunity to get to manage our joint information system as we move through this coronavirus situation that's impacting our state and our nation and our community. So the idea is not to limit information going out, instead to enhance that information by bringing it all into one source, fact-checking it, making sure that our community, our citizens and visitors are getting up-to-date, accurate information that they're seeking and trying to get that word out. Our goal is not to limit any organization or agency from putting out information related to their organization or agency, but if it has to do with the COVID-19 or coronavirus and the impact to the community, closings, changing operations or services that are delivered, we want to bring that through one source. Dothan-Houston County EMA.org is a great resource. They're constantly updating. It's a very interactive site, and the goal is by this afternoon to have each of these agencies linked there. So if you're looking for information from anyone who speaks today, that you have a link to get to their information that they're releasing. Our plan is to do regular written press updates from the Joint Information Center as conditions and things change. Where we go forward with person-to-person, face-to-face press conferences is yet to be determined, but we do want those to be timely. So we will get that information out to you as this group determines exactly where we're headed with that. So again, what I would ask from our media partners is to continue to be engaged with us. We depend on you so heavily to get information out to our citizens. Our goal is not to bring groups of people together to disseminate information. It's to use you and your resources to reach the mass of people that depend on us to know that what we're doing is prudent and moving forward. So the goal today, we have a number of people that are here that want to provide updates to our citizens. I would ask that any questions be held until the end, because the next speaker may very well answer your question. A number of our speakers have brought subject matter experts with them, so if it's something that needs to be addressed, we will bring them up. I have asked that each person, as they come up, to identify themselves with their title so that you have that for print or for CGs as we move forward for the news tonight. So to get us started, I would like to ask Mayor Mark Saliba and County Commission Chairman Mark Culver to come forward and provide an update from the city and the county.
Thank you, Chris.
Yes, sir. Mayor? Yes, sir.
City Manager.
Mayor Mark Saliba, City of Dothan, Chairman Mark Culver, and City Manager Kevin Cowper, just so you'll know who everyone is. I hope at the end of this press conference you will have more information than you possibly need. That is our goal today. Any questions that you have had, anything that you may have seen on certain sites here and there, we'll now can eliminate rumors and give you facts. That's what we want you to do, to have the confidence that what you see today is only a tip of what's been going on for a couple of weeks now. For with all the entities that will step up here and give reports, there's been a lot of planning, a lot of resources that have been going on since the day we realized that this was going to be an issue. It's, of course, a very, very fluid situation. Things are changing on the national level as well as the state level. Our cities and counties and hospitals and school boards and schools are all on top of it. They are in close communication with the state departments and the entities that we rely so heavily on with information. And we're going to get that information out to our public as quickly as we possibly can. It will change often. As Chief Etheridge said, and Chris Judah, our EMA Director, said, we will be funneling all of our information through them. And we hope that we will have everything that you possibly need to answer all the questions in your lives each and every day. I think there are two things that we need to always need to be mindful of, and that is just a very healthy dose of perspective. We have been in worse situations before, and we've come out really great. The cities and the counties and all these entities that are just in this room are prepared, they're well financed and resourced, and whatever comes our way, we are going to be able to handle it. I am confident of that. That doesn't mean it won't be challenging, because it could be. It doesn't mean it might not be hard, and it might inconvenience some of us from time to time. But in the end, we will do a great job for this community. I wanted to let City Manager Cowper, on behalf of the city, answer and tell us a few specific things, unless you wanted to go next. All right, City Manager.
Thank you, Mr. Mayor. Just a few operational items that may be of interest at this moment. The Dothan City Commission did meet this morning for their regular meeting. Part of that meeting did include approving an emergency declaration for the city of Dothan. In short, that will enable myself and the mayor to make some expedited decisions and bring whatever resources we think are necessary to help with this situation. It will also put us in position for any federal reimbursements that we may be due in the future. We are focusing on our core city services that we will need to continue to provide for the health and safety of our citizens. Certainly public safety, our utilities, water, sewer, electricity, and our sanitation services being those core areas. We're taking measures now to make sure that we're keeping those most critical employees safe and healthy. Just small things, bigger things, whatever we can do to limit public contact at this point to keep them healthy. We've taken a number of measures, again, to limit public interaction, public contact with our staff and with our facilities. I think everybody's aware that we've taken measures to close recreation centers, athletic facilities, in accordance with the CDC guidelines. There are a number of more passive recreation facilities that will remain open, where you can be outside and where enclosed, tight space human contact will not be anticipated. So you will be able to get out and enjoy some of the park facilities. We're continuing to do everything we can to communicate with the citizens, with our business community, our neighborhoods, our elected officials. Rest assured that all of the city staff is working diligently to make sure that our citizens continue to get the services that they need. We are, again, enacting other measures to help protect the public. Expect, for example, when you go to pay your utility bill, that you will not come in contact with a customer service representative per se. You'll be directed to the drive-through windows. We're asking people pay their bills online, drop their bill in the mail. To help with all of that, we certainly don't want to be in a position where people aren't able to pay their bills and their utilities are getting cut off as a result. We have therefore put in place a grace period where we will not be terminating any utilities because of the failure to pay. That's a 30-day time period at this point. As of this morning, we are also limiting contact in terms of issuance of building permits and business licenses. And again, we're asking folks to use electronic means to get those permits and conduct that type of business. So at the present time, administrative offices remain open. The only facilities that we have closed are the recreation and athletic facilities. We will be continuing our after-school feeding programs as customary. Those will be open tomorrow, 2:45 to 4:15 at Andrew Bell Community Center in the Wiregrass Rec Center. And those are for school-age children in particular. And so we're expecting heavier than usual crowds at those locations, but that will all consist of food that is packaged and given to those students for consumption off-site. There'll be no dining or socialization that will occur at those facilities. So with that said, I'll be happy to answer any questions at the conclusion. Chairman Toller.
Mr. City Manager, Mr. Mayor. Happy St. Patrick's Day. I think we all have left today, huh? I think it's should be reassuring to our citizens once again, as we have over many years, that we are all working together for your good. I think that is one of the things in our community that we often overlook, but we should all be proud about, that the City of Dothan and Houston County and all of these organizations represented here, our state officials, thank you all for being here, can all stand together in a room and come together for the good of our citizens, and that's what we're doing today. This is an unknown thing we're dealing with. A lot of us have talked about overreactions, but all that doesn't matter now. This is real. This is real, and we're having to deal with it, and we're going to. And we want to be sure our citizens understand that we're going to make sure that they're okay. And the best thing we can do at this point, I think, is assure them that we've got this, and that the hospitals and all of these agencies, health, have got this, and there's no reason to panic. There's no reason to have a lot of the concerns we've heard. Our job is to reduce the spread of this virus. You've heard about social distancing and employee and citizen separation. We've been working toward that. We're working to protect high-risk individuals. We will continue, as City Manager said, to maintain critical operations, garbage pickup, things like that. But we want to minimize the impact that we have on our residents. Y'all have seen all the pictures of the empty shelves of food. That is really not necessary, but we understand. You know, a week's supply of food should be plenty. All we can tell is food is going to be restocked. There's no reason to be stocking a month worth of food. So we would encourage calm in that area. From our specific buildings, we've implemented some restrictions. If you come to our buildings, you will find you will be asked some questions. If you've traveled outside of the country, you will not be allowed in. If you've got the obvious things, fever, health issues, you know, if anyone in your family has been quarantined, all of those kind of things, you'll be stopped. We're asking everyone to consider alternatives. You can get tags and those kind of things online. The courthouse offices are closed, but there are some things that have to be done that you can still do there. You can check with the circuit clerk's office to find that out. As Chris said, the EMA office and the JIC is going to be the main place of information to get what you need. We are eliminating a commission. We typically meet twice a month, and with an admin meeting before that, we're eliminating 3 of those 4 meetings. We'll be having 1 meeting a month for the immediate time to eliminate contact and having more than, as the president said, 10 people together, and as the state said, 20 people together. We're all violating that right now. And we will continue to evaluate information. As you all are aware, this is changing every minute. So we're going to have to look at the information we get as it comes and put our best foot forward. And we will do that. And as I said, the main thing we want to do is assure our citizens that they live in a great community where we can start things like this with prayer. That's important. And where we can tell our citizens that we're working together for their good. And everything's gonna be okay, and they don't need to be in panic mode, or they don't need to be concerned about a lot of the things you're hearing. We're gonna do the best we can to take care of them. So, Chris, thank you for your leadership.
Thank you to the city and the county for the update, and there will be many more of those updates coming. Next, I think one of the things that a lot of people have on their minds is school operations. So I'd like to ask our superintendents, Superintendent David Sewell and Assistant Superintendent Lee Jacobs from the city to come forward and give us an update on where the schools are headed.
Afternoon. Just right now, at this moment, both school systems are closed, and we will be closed until tentatively April the 16th. We will return to school unless there's more direction from the state. We've been directed by the state to close until that time, but that is April the 6th, at normal time. Houston County Schools, we are operating on a skeleton staff. Most of the schools are closed. The central office will be open tomorrow morning for emergencies. All athletic events are canceled. Practices are canceled. All workouts are canceled until we're back in school. The campuses will be closed beginning tonight. That's for practices with the youth leagues. We will not allow youth leagues to practice on our facilities after tonight. We do not have a feeding program in place at this time. We're working on it. We're waiting for permits. We have donated food that has expiration dates to different organizations to try to keep it. We are working on a feeding plan for our students at this time. At this time, I'll turn it over to Ms. Jacobs.
Dothan City schools after today will be closed to the public. We will not have students on campus. We will not have staff. We will be running a skeleton crew at that point. However, what we will have is that we're going to be providing a feeding service at certain schools. So let me just list the schools that will provide this service and the dates and the times, okay? Beverly Intermediate, Head Start, Jerry Lee Fane, Kelly Springs, Morris Lingla, and Selman Street. This will begin March the 18th and run to the 20th, and then we will stop for our spring break and pick it back up at March the 30th, all the way to April the 3rd. We will only serve the meals from 11 to 1, and we do ask that you do not come and approach the building and try to enter it. We will be providing these meals curbside, so please just pull up, and there will be somewhere between 11 and 1 to provide you a meal. It will be in a sacked lunch like. Any child that's the age of 18 and under is available to have this service. You don't have to be a member of Dothan City Schools or enroll with us, so any person 18 and younger can come and have these meals. So just let me say one more time what sites they are. So you need to get a Beverly, Head Start, Jerry Lee Fane, Kelly Springs, Morris Lingla, and Selma Street. So we do have a site, and it will be linked through EMA, so please visit it for more information.
I would also like to repeat, if these return dates change, we will be in touch. You'll be the first to know, because the return date of April the 6th is not set in stone. There's no direction from the state. Thank you.
It's an excellent point. A lot of the things are an unknown at this moment. So for those who have the ability to sign up for the Remind apps or telephone reminders through your school, or again, checking their websites that will be linked through Dothan, Houston County, EMA.org. Our next update coming from our medical facilities, both hospitals represented. I'd like to ask Mr. Charlie Tu from Flagler Hospital and Mr. Rick Sutton from Southeast Health to come forward and give us an update on what's going on at the hospitals and their preparations.
So my name is Rick Sutton, CEO of Southeast Health. And I think one thing I want people to understand is, although we're here to talk about COVID-19 and what the community and the medical community is doing, I want everyone to also rest assured that that both medical centers in this community are able to take care of the day in and day out trauma, diseases, heart attacks, strokes, the things that are going to happen every day that we care for. And so I want y'all to know that normal operations at both medical centers are happening at this time. Now, we're also here to talk about COVID-19. And so I think that you're going to also find that there are a number of changes taking place at both medical centers in order for us to prepare for what we believe is coming. We are limiting entrances at the medical centers, both of them. We are screening individuals who have respiratory issues, but we're only testing people who meet inpatient criteria. And I think that's something that everybody needs to understand, is we are only going to be testing people if they meet inpatient criteria at this time. If they do not need inpatient criteria, what you're going to find is that we're going to suggest that they be sent home and do under self-quarantine. Right now at the medical center, we are increasing our isolation rooms in preparation for what could happen. So we want to make sure that we're doing that appropriately. We're implementing a restricting visitors to only one visitor, and in some cases, in special exceptions, we'll allow it to go up to 2, but we are asking that no visitors under the age of 16 accompany anyone to the hospital for visitation. We are having to work to make changes and additional accommodations to ensure that appropriate staffing remains in specific. A number of the daycares have closed, and so that has created a problem for many of our staff, and so we're working to make sure that we have that need met so that we can ensure that we still have adequate staffing to staff the hospitals and provide the care. But I think what I need to make sure everyone understands, first and foremost, is to take this seriously. I mean, we don't know exactly what's going to happen, but we do know that we want to practice social distancing. We want to bend the spread, we want to bend the curve of this spread, and the way you do that is to limit exposure, and social distancing is what we need to be practicing. And so we would ask everybody to take this seriously, to understand what's being asked of the community. Yes, we will get through this, but we all need to work together. But I want you to understand that both medical centers in this community are ready, willing, and able to take care of people that need the services.
No, sir. Nothing changes at Flowers. What the son said is stands. We are ramping up, just as they are ramping up to take care of the community.
We're nearing the end, but probably one that a lot of folks are waiting to hear from is Mr. Corey Kirkland from the Alabama Department of Public Health, works here in Dothan, Houston County, so he can give us a good update on what's going on here from ADPH.
Good afternoon. Local public health departments for the past few days have been responding to a lot of requests from our local EMAs, our local cities and towns for information requests. We've been attending a lot of planning meetings and things with our local cities, providing information to them through the county commissions and things, working with the local EMAs in different counties to help them with planning and with information requests that they've had. One of the main things too is of course working with our state office. A lot of the things that have been going on, of course, with Dr. Harris and a lot of the press releases that is done from the central office about changes in the state. There's recommendations out there for businesses and individuals. One of the main ones, of course, was the 50 persons or more avoiding gatherings or canceling gatherings that are going to be 50 persons or more. We've had a lot of information requests from local cities and towns on that. We tried our best to help them with making those local decisions on whether or not to carry out functions. There's also a recommendation for senior adults with chronic health problems to avoid gatherings of 10 or more persons unless it's a family gathering. We also have restaurants have been told that if you can limit your seating area to 50% of your original capacity, to do that, to help limit the exposure, the face-to-face exposure. If you do curbside, if you can do pickup and those kind of things to help limit that. One of the main things that we've been working with a lot of them too is on the, as he said, the social distancing. Reiterate that the 6-foot rule, staying home if you can, will help us get ahead of this virus and help to shorten the length of this pandemic. Our local offices right now are still open. They're open 5 days a week from 8 a.m. to 5 p.m. We do expect some changes to that in the future. We are looking at ways to do visits outside at the car to limit people's exposure and having to come inside of our buildings and wait in a busy waiting room. Right now, though, through the end of this week, I do expect us to be business as usual at all of our county health departments, Monday through Friday, 8 to 5. All of our services are available. If the public has any questions about those services, they can call that county health department, and we can certainly make appointments or change appointments for them, do anything that we need to do this week. We will be changing some appointments going forward. That way that if we can scale our own staffing down to help meet the need, but still be open for business so that our patients that need us the most sometimes during these side events, we will still be open for them. Again, I'd like to thank the city and the county for everything they've done. They're great to work with. We're happy to continue to help them in the future.
And to bring us an update from the state, we're blessed to have State Representative Paul Lee and State Senator Donnie Chastain here with us. And we just asked them to come forward and provide us any update that they would like to from the state and from the House, the Senate, and the Governor's office.
Thank you. There's not a lot to be said or added to this. I am proud that the last day we were in session last week, we were able to allocate $5 million additional to the Alabama Department of Health to use that in any manner in which they need. So that will be there along with, hopefully we won't need any more, but I'm sure if there is any need, we will address that. I think that this is appropriate time just to tell how fortunate we are with our local folks, local hospitals, and all those that have been involved. I know personally that the hospitals have not just started this, it's been working on for a week and a half, 2 weeks. We're very fortunate in a lot of ways, not only to have one of the best health facilities in the Southeast, but that they are prepared. Not only that, we're one of the few areas that has had the time to prepare. A lot of the reasons for the problems that have been in Italy has been because of the short notice. Unfortunately, we've had the time to prepare for it, and that's where you come into play, because we want to make sure that you're aware and what needs to be done. There again, watch your local folks. These guys with the city and the county, both hospitals, they have their finger on the heartbeat, so that's the ones that we need to listen to every day.
Thank you. Like Paul said, we're at the state level to assist our counties and cities in whatever way we can. These are times of uncertainty in our nation right now, times like we've never seen before. But our country has gone through some challenges before. And I think that if we stay strong and follow the guidelines that are in place for us right now and do what we've been told to do and use common sense, then that will go a long way, in helping. Our job as leaders here is to provide a calm, is to have a voice that provides clarity to the people that have so many questions and concerns. Chris, I want to thank you for putting this together and bringing everyone together today so that we can disseminate information and that there's one clear message going out to all of our residents throughout the Wiregrass. So again, thanks to all that made this happen today.
All right, I would like to open it up to questions. I do have a couple of things at the end of the question and answer period that some reminders, some specific information that I want to make sure that we're able to get out. I want to hold some of that toward the end. But I would ask if you have specific questions, if you'll just raise your hand, let us know who that question would be for, and we'll get the appropriate person up here or their subject matter expert. Yes, sir.
Yeah, I have some questions, please, and if they could go to the podium dance. I'll begin with Corey Kirkland, maybe the best person to address this. We hear about these about the spacing, the social distancing, they call it. I know it's not enforceable, but how does that apply to the workplace? And what would be the recommendations of the Public Health Department as far as creating space in the workplace?
First thing I would say is if anyone in that work site can work from home, just so that you can decrease the number of folks that are present and that work site. That would be the number one suggestion. If they can work from an alternative site, maybe it's not home, but if there's other offices that they maintain and you can spread employees out, that would be one thing they could do. There's information on our website for employers, a guide that they can go step by step on how to plan and how to work through a situation like this where you're trying to distance employees. Eating facilities, if they have one inside, that may be a little bit more difficult, but rearranging the tables, staggering their lunch time so that there's not as many people in that cafeteria or that break room at one time.
Specifically, if you were on, say, a production line and you got working in very close proximity, I guess you can do that if you want to, but is that not something that the health department would advise against?
I would advise against it, but also there are certain, jobs and there are certain industries that are going to have to work with what they have, so to speak. I mean, if you can spread that out, if you can have less people on that line throughout the day, maybe add a shift or change shifts, that would certainly be a way to approach it. I would say that there's no one set thing you can do that's going to work for everyone. Every employer probably needs to meet with their managers, meet with their employees, meet with all of them, and get suggestions from everyone that works there.
Thank you, Mr. Kirkland.
I have a question, please, for Mr. Tu and Mr. Sutton. We're getting several calls at the Eagle with people wanting to know how many testing kits you have. How many testing kits does each hospital have?
I'm unaware of exactly how many, Flowers has. I
Yes, sir.
believe that y'all are probably in the same boat that we are. We have several hundred testing kits at this time, but we are not prepared to start doing like drive-through testing sites and all that because of the limited availability of tests. One of the things we want to make sure of is that we have people that meet inpatient criteria. We do want to test them. We want to make sure that then the next level goes down, because remember, we've got to also protect the healthcare workers,
Right.
because that's the next level down, so we want to do that. Now, it's my understanding that there are test kits going to be coming available sometime. I don't know where they're at, and I don't know when they'll show up. So I don't have the answer to that. At the hospital, I presume at Flowers as well. It's few and far between. We're getting orders, we have orders out, orders that are waiting to be filled, but that's what we have, is several hundred test kits at the medical center.
Now, you had also mentioned you weren't prepared for drive-up testing or
That's
drive-through
correct.
testing. Do you have any idea when you may be?
We do not know. We have a supply chain issue at this point, so we don't know that.
Once you can sustain that supply, then you can create other opportunities, but right now, that's not possible.
I have a question for the superintendents, either one or both. Ms. Sewell, Ms. Jacobs, both. I don't think there's anybody that believes that school is going to go back in on April 6th. In fact, there's a lot of speculation out there that school won't go back in this year. Even if you just look at the president's recommendation, that would take us deep into May, which is going to be the school end of the school year. My question, and maybe you don't understand, it's a state education issue, but these students, if they're not able to complete this year, what happens then? Do they pass? Do they retake the grade? What happens?
We're waiting to receive instructions from the state on that. That question has been raised by different agencies, and they have not given us any instructions on that. So I would like to say something I don't mind, but that question has been approached by different education.
And what, Ms. Jacobs, let me ask you this. Obviously, we've got children now at home or wherever they are. It's a tough situation. What can parents do to keep their children engaged in the learning process so all is not lost?
To me, my strongest advice would be keep them on a schedule, okay? Schedules are good, and that's what we do at school. You know, have a time that they have outside play, have time they have, if they're a video gamer, let them have some video games. Then have time that's reading, have time that's writing. There is online games that are free. We have created an online resource for teachers and stuff. A lot of schools send stuff out just for extra practice, not for grading, but just so you can have some stuff to be stimulated. But stimulate your brain. Read, talk, have conversations, do things like that, and that would keep them on track.
Now, this website Scholastic is offering free
Yes.
training. Is that in your eyes, a credible learning
Yes,
website? Okay.
I would recommend that.
Thank you.
Yes, sir.
I have a question for whoever can answer it. Our blood supply is critically low, and even more so than usual, and can people still donate blood if they can? Are there precautions they need to take? Where, when, how?
Yes, sir. I'm gonna need you to stop reading my notes. That was on my list of things to wrap up with, but you're right. Not because of the virus, but because of what I believe Mr. Sutton and Mr. Tu reiterated is we still have traumas in our community. We still have surgeries. We still have procedures. We still have a need for blood. And we're seeing that people are shying away from the opportunity to donate. So we would encourage anyone who can to seek out Life South locally, Red Cross locally. There are blood drives that are continuing in our community. They're using all of the proper procedures, just like they always do, to protect their donors and to make sure that that's done. But that is something that we had planned on talking about specifically is accidents don't stop happening in our community. So the need for blood is still going to be there. And just like you said, we had a shortage as we entered this. So it is not getting any better because people are not wanting to donate. So those who can, we encourage you to continue to do that. You can get those, we'll have the links on the Dothan Houston County EMA.org website, as well as Google Live South, Red Cross, Google Blood Drive. Find an opportunity to give if you do give, and please encourage your family to do the same as they can do that.
Also, as it concerns government, I know Mr. Culver said that they're cutting their meetings. Is the city cutting out committee meetings, DDRA and all that kind of stuff? And what about the legislature, if and when they go back?
We're going to continue to have some of our meetings, mostly because at most of the time it's just the panel that's there, and that's less than about 10 people. If we have to have a bigger meeting, we'll put people in the lobby with social distancing requirements upheld, and then bring people in one at a time, like we did this morning with our city commission meeting.
And how's the easiest way for people to find the live stream? I found it, but I mean, you have to look for it.
Yes, good question, thank you. And I did want to ask a question as well, so to get clarified. But go to our city website, and or Facebook, I'm being corrected. Facebook, go to the Facebook, City of Dothan Facebook page, and you'll see the link there, and you hit on that link and you can do all the live streaming there.
We're streaming on YouTube and Facebook.
YouTube and Facebook live streaming. And I think it's important, I think we all take for granted that we know what we're supposed to do if you start feeling a little sick. I would like maybe somebody from the medical community to kind of take that steps what to do first. Do you go to the doctor? Do you call the doctor? If you can kind of walk through that, I'd appreciate it.
I'm Dr. Jim Jones. I'm an emergency physician at the medical center. And basically, we, with regards to this pandemic virus, coronavirus that is out there, if you develop cold symptoms, basically, you may just have a common cold that could be a coronavirus or could be a coronavirus 19, COVID-19. We know that the virus can cause a respiratory problem. It's typically a lower respiratory problem. It's associated in about 50% of the cases with fever, not necessarily high fever. There are some other symptoms that can really imply that the disease is progressing quickly. If you have shortness of breath, having trouble breathing, your lips turn blue, those are signs of a real emergency, and you need to go to the emergency department, the nearest department. If you are just having a cough, you don't feel that bad, you may think maybe I need to be tested for a virus. If you go to either of our facilities, hospitals, that testing will likely not be done unless you were sick enough to be admitted. The health department would be a resource for testing. Also, we hope, as several people mentioned earlier, that there will be some testing sites available. Very little testing has been done, relatively speaking, with regards to this pandemic. And the word pandemic implies that it's worldwide infection, infectious process that is out there. That doesn't necessarily mean it's going to take a lot of lives of people that get it. In fact, indications are only about 2 to 3% will succumb to this illness, and mostly those over the age of 65, although there are cases that are hitting younger adults. The word pandemic, though, there are two other words that start with a P that are really more important right now for us to focus on. And that is preparedness and prevention. With regards to prevention, you've heard people talk about separating people, social distancing. Very important. 6 feet is kind of the guideline. This appears to be droplet transferred. So droplets that come when you sneeze, when you cough, when you speak forcefully, will land on surfaces in the area where people are communicating, congregating, could actually be transferred to you if you're close enough. So social distancing is very important. The other big part is hand washing with soap and water for 20 seconds or so. And there's tricks to say your ABCs or sing happy birthday to yourself. Those are good ideas. The other really important thing is when you cough or sneeze, how do you do that? Go to your elbow if you don't have a disposable tissue. Okay, that's important. Stop the handshaking. I noticed today as we all came together and greeted each other, a lot of elbowing. Keep that up. That's very important. The preparedness portion. Our lives are changing a little, even here in Dothan, right? I mean, we're seeing activities that we don't normally see. Those of us in healthcare are very aware of the preparations that are occurring. Our children aren't in school. They're being kept home. Things are changing, so we need to prepare for a period of time. Probably 2 to 3 to 4 weeks time frame. Now, the supplies, somebody mentioned empty shelves and some hoarding that's going on. We need to understand that supplies will be replenished, and really just take what you need for 2 weeks and leave it for your neighbor to come in and buy. With regards to other issues like medications, prepare, if you are on medications that you need daily, to have at least a month's supply available. So try to make that happen. That's kind of it in a nutshell. Any other specific medical questions? Stay healthy.
All right, any other questions before we wrap up?
How does information that the public needs to know get to them from the Joint Information Committee?
The Joint Information Center will be sending out regular updates through press releases to the media. Those will be posted as well on the DothanHoustonCounty.org, DothanHoustonCountyEMA.org website, and we will be feeding that information as well to 211. And 211 was one of my notes to talk about, is a tremendous resource in our community. If you have needs, if you have questions, where to get information, or how you need assistance with food or clothing or childcare, whatever that is, 211 is a tremendous resource. It is a clearinghouse of human services information to assist our community. It's staffed 24 hours a day, 7 days a week, and they handle a wide variety of needs and concerns from our community. So we'll be providing all of that information through written press releases to our media partners who are just tremendous in helping us get our message out, as well as the websites and digital media as well.
Thanks. I wasn't shooting for a plug, but.
But you got it.
I was,
You and John are together, y'all are reading my notes.
I just want to make sure that 211 was copied on those
Yes, sir.
emails, so
Yes,
we
sir.
could get that information out.
We will ensure that we do that. Again, I want to remind everybody about blood drives going on in our community. Please continue to give there. Dr. Jones talked about the P's of preparedness and prevention, and I would say let's replace this panic with prudence. Be prudent, replace misinformation with information, and that'll help you replace fear with facts. When you do those things, and we're able to communicate things from our city leaders, our county leaders, and our state, the Department of Public Health in our schools and our hospitals, allows us to make sure that you can make informed decisions. I think we heard from the schools that it's very important for our children to maintain a routine, whatever that routine may be. And they've provided great resources, from online resources to feeding programs as those become available, to make sure that our children are taken care of. I think from a public safety and city and county government standpoint and a healthcare provider standpoint, we take for granted what we call a COOP, which is a continuity of operations, and would encourage all businesses to have a continuity of operations plan, whether that's small or large business, which is how do we continue to operate if we have people calling in sick or can't come to work because of childcare? How do we continue to provide if we're an essential service? Medical providers, mental health providers, key production, as someone talked about, that has to keep going. How do you maintain your operations? And all of that is laid out in a continuity of operations plan. You can look that up and get some really good guidance from there as well. So encourage everyone to review your plan or develop a plan as we move forward. And I think we would be remiss in closing out if I didn't mention two things. We always talk about how great our community is and how we take care of each other. Take an opportunity to check on your neighbor, especially if you have older neighbors that don't need to be out and shopping at big box stores, retrieving supplies. If you can help them, please help them. Leave it at their doorstep. And take care of your neighbors. That's what the Wiregrass is known for. It's taking care of each other and loving each other. So I would encourage you to continue to do that. As well as, lastly, Dothan and Houston County is very service industry oriented. A lot of people depend on our restaurants, our food services and things of that nature. So as we're social distancing, please continue to remember our local businesses. They're providing curbside service, delivery service, and all of those things. There are a lot of service industry folks that are going to be impacted significantly by people not being in restaurants and things of that nature. So please continue to do that as you feel comfortable and as the services are provided. I think at this time, unless anyone has any additional questions.
I do, sir.
Yes, sir.
I have two brief ones, and I will
Okay.
be brief. The first one is for our state representative, Senator Chastain and Representative Lee. If you're still there, my question for you, Representative, is we have to, the legislature is in limbo at the moment, won't be meeting, some canceled meetings, and I don't think there will be maybe forum. It's your obligation to get us a state budget and address other matters. How will you accomplish that? And for Senator Chastain, I know you've been in the loop on these runoff elections that are in limbo. What are you understanding about that right now? And brief answers is fine. I need to go.
The health committees, the committees chairs canceled all the meetings for next week. This week was spring break. Next week, we were supposed to go back full-time. Wednesday is committee meetings. Those were all canceled. Friday or Thursday of next week, the speaker will come in, gavel in, and then gavel out. He will recess. We're not planning to go back until the 31st. We are obligated to pass a budget. It would not surprise me, according to what happens here, we will go back and pass an education budget, and a general fund. There are two things required by the state legislature. That is to pass a budget. We will pass a budget before we leave.
And to your question regarding the runoff elections, it just so happened that on last Wednesday, Secretary of State Merrill brought me a bill that would address situations just like this in the event of runoffs, disasters, and obviously the bill didn't get dropped in time, and there's nothing we can do right now as far as changing that law. But we will, when we go back in, that will be a priority. And right now, the Secretary of State does not have a ruling, the latest I've heard from the Attorney General, on postponing our runoff elections.
Okay, I'll have one final question, and I'm done. It's for Mayor Saliba. I don't want to say that the situation is going to get much worse, but you would agree that 2 weeks ago, we have said things we've seen happen were going to happen. You wouldn't believe they were going to happen. But if things continue to progress and get worse and worse, are you working on a contingency plan if we get under much more dire circumstances where businesses have to be closed, if people are quarantined in their house? Not suggesting that happens, but again, we're seeing unprecedented times. Is the city developing a plan for that?
I believe earlier, I'm not sure if it was Chris or city manager who mentioned the COOP, the continuity of operations plan. And that does provide for essential city services to continue to be maintained, no matter what the issue is and how bad it gets. And so we're maintaining that, making sure that second in commands are a distance from each other, so that there's always somebody that can take over departments. But though each department will have, and already has, their continuity of operations plan in place.
But would you consider a curfew if you thought it was necessary?
Well, we're taking all of our guidelines. I think when you and I have talked before from the state, the state Governor Ivey's office, State Department of Health, Alabama Department of Health. Of course, they're getting a lot of theirs from the federal level as well. I think whenever we hear something that Birmingham has done, and they close the restaurants, it strikes a chord of fear in everybody. So I've gotten 15 texts and calls today. Are we shutting our restaurants down? No, we're not shutting our restaurants down at this particular point. And we don't want to shut our restaurants down. Nobody in this room wants to cut down and cut back on our economic activity. It's a numbers game. And as our hospitals have said, the more we can flatten that curve and bring that curve down, the less we're going to overwhelm our hospitals. We are hoping that the line will start to flatten by a lot of the protocols that have been put in place, and that we don't see curfews, we don't see restaurants having to be shut down like they're having to be done in other parts of this country. And so it's one of those things we say. My father said, never say never to anything. And we never thought we would be where we are today. But we are here. We need to do what's best for our whole community. It's not only a medical impact, but it's an economic impact. And so we're hoping that we don't have to take such severe protocols as that.
Thank you for your patience.
Absolutely.
All right, so once again, Dothan, Houston County EMA.org will be a clearinghouse of information. 211 will be a great source of information. And I did have a note too, for those who are concerned about medications and getting out, going to their regular doctor's appointments, whatever that may be, communicate with your provider. Each of the different healthcare providers will have plans in place to make sure that you are able to be taken care of, whether that's by telephone or telemedicine or whatever the case is. So communicate with your providers rather than seeking out the ER for those normal things during this time when we have such a rush. So again, thank you to everyone for attending, especially to our media partners, and we will put out an announcement when we do another one. Thank you very much.
See you, sir.